Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope you're doing well, however you are and wherever you might be listening from. This is episode 153, where every single week we bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And this episode today, folks, is going to be a little shorter than normal because I am sick. I am under the weather. I'm not feeling well as I talk to you, and I have an obligation to bring you an episode. So that's exactly what we're going to be doing here today. But this episode is going to be much shorter than our normally scheduled program. So I really do appreciate your patience and understanding about that. We're going to be doing 2 segments today instead of 3. So anybody that doesn't like our 3-segment format that listens, today is your lucky day. We're only doing 2. So that's what's going on with that. Now, folks, today we're going to be talking about a new Medicare scam that's been kind of going around, and an article recently came out about it. The article was put out, let me see here, on January 31st, actually. And it's called Ask Sam, Beware the Medicare Card Scam. I will post a link to this in the description of our YouTube video of this podcast if you watch this on YouTube. If you don't and you'd like to see the article, you can either Google it yourself or go check out that link on the description of the YouTube video for this episode 153. But Medicare scams are nothing new. Medicare scams are something that have been going on as long as I can remember, and they kind of fall right in line of billing fraud, identity theft, and the whole 9 yards. It was a big problem for such a long time that Medicare had Social Security numbers as to people's Medicare cards, which, typically a Medicare number was a Social Security number with a letter after it. Most commonly, it was that person's Social Security number. However, if they were drawing off of their spouse's Medicare, if they didn't have enough working credits, which every now and then you run into something like that, it could be their spouse's Social Security number. But needless to say, it was a Social Security number. And typically it followed with a letter after it. It could have been an A, it could have been a B. If it was their spouse's Social Security number, there was a multitude of different things. It could have been a T. And each letter described something differently. Now, Now, one thing that we need to keep in mind is since they changed the Medicare numbers in the last year to year and a half, this kind of stuff was supposed to stop, but it doesn't mean you should just be walking around and handing out your Medicare number freely. You need to make sure that you're protecting it. Now, it's not as problematic as if it was your Social Security number. Now the Medicare numbers are jumblized codes of letters and numbers, and it is much more secure, but it's still something that you want to keep to yourself, and you don't want to share it with just everybody. And it appears the scammers have kind of figured out that they can still do things that they should not be doing with the new Medicare numbers. We've seen it all over the years. We've seen people sending out letters, and some of these scams have been incredibly well thought out and planned out. We saw situations where they would send out letters, and they would use the Social Security logo on their letterhead. It would look very official. It looked like it would come from Social Security, or sometimes it'd come from quote unquote CMS, the Centers for Medicare and Medicaid Services, and they'd want you to send some information back. And it would be to a undisclosed location that was not an address of Social Security or CMS. And that's how they'd get you. It's a scary world today, especially with everything being online, especially with everything being digital. A lot of people are now familiar with the deep web, the dark web, where basically, people can sell things that they, like identities and steal identities, and they can do it. And a lot of times it's hard to trace. It's untraceable. They can sell drugs. There's all kinds of horrific things go on. We live in a day and age where technology has brought out the best in people, and it's also brought out the worst. It's made criminals harder to catch, and it's also made us as individuals have to jump through a little bit more hoops as far as protecting our own particular and personal information. Now, this particular scam, I'll read you a little bit of the article. It's called Ask Sam, Beware the Medicare Card Scam. So let me just get to where I need to go. Okay. All right. So it starts out like this. To help protect against identity theft, Medicare issued new cards that have unique numbers rather than using your Social Security number, according to a statement from the U.S. Centers for Medicare and Medicaid Services. Your new card has a new Medicare number that's unique to you instead of your Social Security number. Don't share your Medicare number or other personal information with anyone who contacts you by phone, email, or by approaching you in person unless you've given them permission in advance. Okay. The FCC reports that after the new cards went out, it began receiving complaints about scammers pretending to be Medicare representatives, some of them using caller ID spoofing to mask their identities. Some calls were live, others were robocalls. In addition to callers who claimed to be from Medicare, others may pose as medical insurers and threaten to cancel your insurance if you don't share the information from the new card, according to the FCC. If successful, these identity thieves can use a beneficiary's information to file false claims, fill prescriptions, or sell it to other bad actors on the dark web, okay? So this isn't anything necessarily new, but a lot of people are under the impression that now that the Medicare numbers are not your Social Security number, that you're completely protected and they can't do anything with it, and that's just not true. Is it more secure than it was before? Absolutely. Is it something you want to post on Facebook? No, absolutely not. The article continues to say, Medicare or someone representing Medicare will only call and ask for personal information in these situations. A representative for a Medicare health or drug plan can call you if you're already a member of the plan. The agent who helped you join can also call you. So that would be like me, If I'm working with a client of mine, I can call and, I might need some information to kind of get an application process. That's a different story. A customer service representative from a 1-800-MEDICARE can call you if you've called and left a message or a representative said that they would call you back. So they're not just typically going to call you out of the blue. Keep that in mind. They go on to say that you should only give personal information like your Medicare number to doctors, insurers acting on your behalf, or trusted people in the community who work with Medicare. If someone calls you and asks for your Medicare number or other personal information, Medicare says that you should hang up and call them at 1-800-633-4227 if you suspect identity theft or feel like you gave your personal information to someone you should not have. Make sure to contact the Federal Trade Commission for assistance. So, is this anything new? No. People have been trying to scam people on Medicare forever. The scammers kind of look at people on Medicare as, they're older, they're senile, they're gullible, whatever the case might be, and it's completely not true. People on Medicare are some of the most resilient people we have in the community today, but you have to know what to look for. You have to know what you need to avoid. You have to know what you need to be aware of and kind of what's coming your way. My advice would be, just like the article said, if anyone calls you that you don't know, asking for your Medicare number, and even if it shows up from a caller ID that you might recognize, be very, very careful. Because nowadays, people can change their caller IDs in an instant and then change it back to something else before you can catch on to it. It's very, very easy for these scammers to make everything on the outside look like it's legitimate, even when it's not. You have to be very, very careful. And you can never be too safe, in my personal opinion. Don't go anywhere. I have to take a quick break. I'll be back in segment 2. And like I said, this episode will only have 2 segments, so it will be 2 out of 2. Don't go anywhere. I'll be right back. I have some final thoughts I'd like to share and some updates on some news I have. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me through that break. This one's pretty simple, folks. I mean, everybody that's listening to this is very smart. I know that you know kind of what to look for. A lot of this isn't necessarily new information. Medicare scams have been going on for a long time, but it's something that I wanted to do an episode about and bring awareness to you. So just be careful. If something doesn't look right, call your insurance company, call your agent. If you're a client of mine, call me or call Medicare. Make sure you're getting it from the horse's mouth if something doesn't look right. If you get something in the mail that just looks a little fishy or looks like it could be fake or something like that, trust your gut. Do not think you're being silly. Worst thing that can possibly happen by checking on something is it was something legitimate and you just made sure about it. But that way you can sleep better at night. You don't want people getting your information. It's harder to stop it nowadays than probably it's ever been. Okay. Thanks so much for taking some time with me, folks, and being patient with me as I kind of fight this sickness. I don't do very well being sick. I'm such a big baby. And it's hard for me to kind of get up and get locked in for the podcast when I'm not feeling well. But I've done it a lot over the years since we started, so I don't intend on backing down anytime soon. But when I am sick, I might do a shorter episode, if nothing else. You know. The other thing I wanted to mention to you folks is the insurance funnel. It's done. It's ready. And it will be coming up shortly. We're aiming for next week. I'll let you know exactly when it comes out. It'll be on Amazon. And I will be doing a couple of other podcast shows to do some promo runs. And I'll let you know what those shows are if you want to hear my guest appearances. Thanks so much for listening, folks. If you're watching this on YouTube, please don't forget to subscribe for future content. Like the video. Let us know what you'd like to hear me talk about on future Everything Medicare podcast episodes. But if you're listening to us on a podcast platform that allows you to do so, please leave us a 5-star review. It helps us reach more people just like you that need to hear our information. Hope you have a fantastic weekend. I'm thinking about you. I'm thinking about what we can bring to you to kind of make your lives easier and simpler and less confusing. Thank you so much for taking some time and listening and being so gracious and being patient with me as we cut this episode short. Be back with you Monday. Hopefully I'm feeling 100% better. Talk soon.